again. We made it another week. We welcome all of you back. Hope you're doing well. We're excited. I will just say we crossed the halfway point of the legislative session, which is great news. Unfortunately, it means like the worst half is still to come, but we appreciate our legislators. They're doing incredible work out there. We also just want to ask all of you to be safe this week. We do have a significant storm coming, and we certainly need the water. So I just want to reflect maybe in the beginning a little bit about where we are in this pandemic. Of course, I think it was very close to this time, maybe last year, maybe a week later or so, when Dr. Dunn and I was the lieutenant governor, we did our very first press conference about the coronavirus. We knew very little about it. We knew it was here in the country. We talked about taking precautions. We talked about it being flu season and encouraging people to get their flu vaccinations at that time. And it's crazy to think how the world has changed and how our state has changed over the past 11 months. We've of course lost far too many lives. So many people have worked so many hours. Hundreds of state employees, local healthcare employees as well are working on this response. But during our weekend operational briefing with those employees this week, we really felt a shift, and that's what I want to share with you. It's that optimism that we've been talking about. Someone on our team said, it feels like we're in the fourth quarter of the pandemic, and we've got a lead now for the first time. It reminds me a little bit of the Jazz game last week when things are close, but we can see the end, and things are going well, and we have a whole bunch of Donovan Mitchells that are stepping up right now. And those are our vaccine providers, those who are working so hard every single day to get vaccines in arms, and that work is starting to pay off. I also just want to recognize the testing that is happening out there, as well as isolating and contact tracing. But we've said from the very beginning that until vaccines come, that testing is the thing that would help us get through this, that would save lives and allow us to get our lives back to normal. And we are doing so many tests now. As you all know, we changed the way this week that the health department changed the way that they're measuring that test positivity. This is now we're doing it the way almost every other state is doing it as well. It's the number of positive tests divided by the number of total tests. But the number of total tests, as we see it right now, 27,000 tests. People testing regularly. Even here at the Capitol, we're testing a couple times a week. Legislators are testing a couple times a week, and we haven't had any positive tests for several days, which is great news. We had some at the beginning. We're able to isolate those legislators and keep people safe. And so that rapid increase of testing is helping us to drive those numbers down, making our contact tracing much more effective. And we're seeing some of the lowest numbers we've seen in several months, which is great news. So let me give you an update now on some of the numbers. When it comes to vaccinations, total doses administered, first and second doses now, 462,770. A week ago today, that total was 362,000, which means that we had an increase this past week of weekly, again, of both doses administered of over 100,000. That is our largest week yet, and the first time we've crossed that 100,000 threshold. So I could not be more proud of the teams, local health departments, and others that are getting those needles in arms. So far, our largest single day administration record was 21,612. That was on February 4th. Some really, really good news, as you all know. I don't have the latest numbers, but about 40% of our deaths have come from long-term care facilities, and we have now vaccinated 89% of our long-term care facility residents. That's a huge number, and again, is going to help really reduce the hospitalizations and the mortality rate there. We've done at least 33,621 doses at long-term care facilities in Utah. We are still using all of our available vaccines every week. That was the very high bar that we set our first week as an administration, and everyone has responded. So also in Utah, and this is again great news. We have about 229,895 people who are age 70 or older, and that as of yesterday we have vaccinated almost 49% of them. So after today, more than half of those 70 and older in the state will have received their first dose, and some of them are now receiving their second doses. That again is a huge number because about 73% of the deaths in our state have been those 70 years of age and older. So to have half of them vaccinated means that we can significantly reduce those deaths. And over the next couple weeks, we'll get all of them that want it vaccinated. So we encourage all of those who have not yet, please make sure that you're watching, working with your local health departments to get signed up. This week, let me talk about some of the progress and some of the announcements from the federal government. We know this is still moving more slowly than anyone wants, and we can't wait to open this up to the next cohort. But each day we continue to get better news. This week, the federal government announced another increase in weekly allocations to the states, now up to 11 million doses nationwide. In Utah, that meant an additional 4,200 first doses for us each week. We will take them and we will use them. They also announced that they will be directly distributing vaccines. You'll remember last week they announced that they would be distributing vaccines to some of our Smith's food stores and some Walmarts in the state. Well, this week they announced another, and this is above and beyond what we're getting now, another allocation to certain community health centers. We're still working on figuring out which community health centers will be getting those limited doses, but we will bring you more information as soon as we receive it. We're also very excited because, as we mentioned last week, Johnson & Johnson filed for their emergency use authorization with the FDA. With Moderna and Pfizer, that took about 20 days to 3 weeks to get that finalized and approved. We're very hopeful. There are no guarantees, but all indications are that the Johnson & Johnson vaccine will get approved over the next couple of weeks, and we've been told by the Biden administration that next week they will get us the final numbers on what those weekly doses of Johnson & Johnson will look like, again, once they're approved. But it's important to point out that as with the other vaccines are being manufactured already, even though they haven't been approved. So we anticipate a significant increase coming to the state from Johnson & Johnson once those are approved. Now, just a couple reminders before I turn it over to the Lieutenant Governor. We have heard a few stories last week of unfilled vaccine appointments, and we know that happens. We try to plan for that. We try to overschedule a little bit because we know that sometimes people won't show up. But we are confident. First and foremost, this is important. We're confident that our local health departments are not letting any of those vaccines go to waste. So we are still using all of our allocation of vaccines. But we ask that you please be aware that each local health department has a scheduling system, and if you have scheduled a vaccine, please come to that vaccine appointment or make sure you call and cancel it so someone else can fill that spot if you decide that you can't be there or you're not using it for whatever reason. You can go to coronavirus.utah.gov/vaccine to find out more about those scheduling systems in your area where you can go to sign up. And again, please keep your appointments or cancel it. They're working to be as flexible as possible and committed to filling all of those slots every week. We've also had some stories about people who have missed their second dose appointment. If you do, please make an appointment to get it as soon as possible. We encourage you not to miss that second dose. The trials that were conducted with both Moderna and Pfizer were all incorporated a second dose. Well, we do know there is some immunity that comes from the first dose. The full immunity only comes from getting that second dose as close to your scheduled time as possible. So please make sure that you're committed to getting that second dose. dose. And with that, last time we told you that coming up in March, we are anticipating a significant surge in vaccine availability coming to our state. In fact, we believe that with the enormous increase that we will be receiving in March, April, and May, that it is possible, if everything goes right and is planned, and it rarely does, but if that were to happen, that we could have a vaccine available for every adult in Utah who wants one into May. But in order to do that, there is an enormous amount of planning that has to go into place. It is a logistical a task that exceeds really anything we've ever done here in the state from a medical perspective. And we're going to need a lot of help, a lot more help than we have right now. And Utah is the volunteer state. I know Tennessee tries to claim it, but for the past 12 years, we've led the nation in volunteerism, and we're grateful for the incredible volunteers that we have in this state. We're going to need you. We're going to need many of you. We're going to have to coordinate this in a way that makes sense, and that we can use the volunteer workforce that we have here in the state. And Lieutenant Governor Henderson, on top of a million other things that she's been doing, has been working really hard, as we mentioned last week, on figuring out how we will collect information for volunteers and how we will get that assigned. And so I'm excited to have her come up and share all of the things she's been working on. Lieutenant Governor.
Thank you, Governor. Good morning. As the Governor mentioned, our efforts moving forward to make sure that every Utahn who wants a vaccine gets one and gets one as quickly as possible. It's a monumental effort and a huge task, and something that so many people have been working nonstop for a long, long time on, and will continue to do so. Over the past number of weeks, we've had a lot of people who have come to us and expressed their desire to help. I've had doctors, I've had all sorts of people say, what can I do? How can I help? And so today, we're officially issuing a call to action. We're announcing a statewide effort, a statewide volunteer effort for those who are willing and able to assist in our vaccine operation. Anyone who wants to help can go to www.utahresponds.org. Again, that's utahresponds.org, which is a statewide web-based volunteer registry that helps organize volunteers and coordinates and streamlines our health and medical response to emergencies. Now, this registration at utahresponds.org is open to all medically licensed professionals, so licensed medical professionals, as well as people who aren't licensed medical professionals. So we need a lot of people, and we need medical professionals and others who can help and who want to assist. So when you go there and you sign up, you can see areas where we have need, and you can get your credentials verified. You can be assigned to assist in a place where you're most needed. We're asking for people who want to help to please sign up and be willing to work for at least 4-hour shifts. So as I mentioned, we need licensed medical professionals as well as people who are not medical professionals to assist here in our local health departments, as well as our statewide vaccine clinics that we're going to be standing up and opening up in March as our vaccine supply increases. So we have immediate need, though, for vaccinators, people who can give vaccines, who could administer vaccines. We have an immediate need for those. So, and here's who we can use to help give vaccines. And if you're one of these people, you can actually, and you don't currently, you're not trained to give shots. We can engage in the training and do all of that. But these are the people that we need for vaccine administers and for people to monitor people after they get their vaccines. And they're anybody who has been licensed by the Division of Occupational and Professional Licensing, Utah Nursing Assistant Registry, and the Utah Department of Health Bureau of Emergency Medical Services and Preparedness. And the list includes the following: physicians, so medical doctors and DOs, podiatrists, pharmacists, pharmacy interns, pharmacy technicians, nurse practitioners, physician assistants, registered nurses and licensed practical nurses, temporary graduate nurses and temporary registered nurse apprentices, medical assistants, certified medication aides, certified nurse midwives, respiratory therapists, dentists, dental hygienists, optometrists, physical therapists, physical therapy assistants, occupational therapists, occupational therapy assistants, paramedics, advanced EMTs, and certified nursing assistants. So those are who can help on the medical side of this. Other areas where we need help include traffic control, data entry personnel, security personnel. To view a list of the qualifications for vaccinators and other roles, you can find that information on coronavirus website, coronavirus.utah.gov, under the call for volunteers. And when you accept your volunteer assignment, you'll receive further training and further instructions if needed, and you'll also be managed and deployed by the organization's leadership. Those who volunteer, as I mentioned, will be asked to commit to at least 4-hour-long shifts at a time. And please know, this is really important, please know that just because you sign up to be a volunteer, that does not mean that you qualify for a vaccine. So volunteering does not mean you get a vaccine. You've got to wait until it's your turn under the categories that the governor announces. But there is a significant need, especially as I mentioned right now, for vaccinators. We need other people as well. Please go to the website and sign up. And it may take a couple of weeks for us to use you as we get these statewide clinics, but we can use vaccinators immediately. So please, if you or anyone you know would like to volunteer, or any organization or group that you might belong to, please get that information out. Again, it is utahresponds.org. We need you badly, and this is the bright shining light at the end of the dark tunnel. So thank you all so very much.
Okay, good morning. Our rolling 7-day average of new cases is now at 1,049. This is a decrease from last week when it was 1,264. And our 7-day percent positivity average, if we're calculating it by test over test, it's at 6.7%. If we're calculating it person over person, which we've been doing since the beginning of this pandemic, it's 14.8%. And that's a decrease from last week when it was at 16.5%. As we transition to using test over test versus person over person, I'll be reporting both just so we can get used to the scale, and eventually we'll move completely to test over test for the reporting. CDC released guidance yesterday on the quality and fit of mask that is necessary to prevent the most spread of COVID-19. There's been a lot of discussion on should you wear one mask, 2 masks, what type of mask should you wear? And now we have good scientific evidence that fit and quality are the 2 factors that matter most. So when it comes to fit of your mask, you want to make sure that it's snug around your face, that there's not escape of air when you breathe out, because that's how droplets can escape and infect somebody else. And when it comes to quality, we want to make sure that the mask has multiple layers. So if you're wearing a cloth mask that has a single layer, wear 2 single layer masks. However, most masks now have multiple layers and fulfill this requirement as well. The CDC found that when 2 people are 6 feet apart and they're both wearing snug fit, multi-layer masks, 95% of the droplets are prevented from spreading to each other. That's a huge benefit to preventing the spread of COVID-19. And as our cases drop, we want them to continue dropping so that by the fall, we can go back to normal. But in order to do this, we need to make sure that the variants don't start spreading in Utah. The variants are more transmissible. They're a type of the virus that's more transmissible. That means that it's easier to infect large numbers of people. And the way to prevent these variants from taking hold in Utah is to prevent the spread of COVID by wearing quality masks that fit tightly and also continuing to adhere to physical distancing and avoiding large gatherings. I'm confident that if we keep doing this as a state, we will see the numbers drop to sporadic by the fall. Thank you.
Thank you, Dr. Dunn. Thank you, Lieutenant Governor, both of you for your incredible work. And we have some time for questions, so we'll go ahead and open that up.
Good morning, Governor. Rick Aaron from ABC4 News. You talked about the logistical challenges of getting every adult who wants the vaccine vaccinated. How are mass vaccination sites going to factor into that plan of getting potentially 2 million adults vaccinated over the next 3.5 months?
Great question, Rick. Thank you. So right now, our team is working. We have what we call the high throughput coalition. So these are, healthcare folks from our local health department, our state health departments that are collaborating every week on how to do this logistically. And high throughput sites are going to be huge. They're really going to be the centerpiece of what we're trying to accomplish. So there will be high throughput sites up and down the Wasatch Front, as well as in some of our more rural areas, and that's going to make that's going to make a big difference. We need sites that can do thousands every day in order to do this logistically. So what you can imagine is a real mix. We'll have these high throughput sites where the mobile can go to get their vaccines. So you can get your car, you go, you're healthy, you're able to do that, and then we have smaller sites in neighborhoods, especially in our less affluent neighborhoods, places that are a little harder to reach, where people can go to their local store, places where they routinely go to get those. And then we have mobile units as well, and those have started going out into these hard to reach areas. And then the final piece is actually taking the vaccine to the homes of people who can't get those vaccines, or who can't get outside of their homes. And so you see we have all of these different layers, but there is no question that the centerpiece, especially early on, will have to be these mass vaccination sites while demand continues to outstrip supply. So you will see lots of those. Again, those announcements will be coordinated with the announcements coming to us about supply. So when we figure out exactly what day that first big tranche of vaccines is going to come, then we will announce all of the sites that will be opening. We have them staged, and so that we can really match the amount of vaccine coming into the state with the number of vaccination sites and the number of vaccines that they can do. We've got lots of partnerships. You'll see them in different places. You'll see them at stadiums. You'll see them at movie theaters. You'll see them in parking lots. There will be all kinds of different places that you can go to get your vaccine.
Hi, Governor. I'm wondering if you can talk about what happens next if the state is indeed successful in getting the vaccines promised and getting every Utah adult that wants to be vaccinated by the end of May. What happens next? Do we stop wearing masks? Do things go back to normal? Or is this going to just be more of the same at that point? Thank you.
Thanks, Lisa. We all live happily ever after. That's what happens. That's the answer. Look, there will always be this tug and pull between, again, keeping people safe and getting back to normal, right? This has been the struggle all along. But I want to be very clear. Our message has to be, in fact, our message will be, we're going to be releasing some PSAs, some public service announcements, a campaign. It's a media campaign that talks exactly exactly about getting back to normal, because we want people to get this vaccine. And the way we get back to normal isn't just that you get the vaccine, it's that enough of us get the vaccine so that we can get to herd immunity. And I know that we hear that number, and Dr. Dunn has shared that number, 70, 75%. Nobody's exactly sure what that number is going to look like. We're not exactly sure what these variants are going to be. But what we are sure is that there will come a time, and we're having these discussions actively, that when we vaccinated everybody that is at risk, and again, when supply is now outpacing demand, then yes, we will go to a different model, and that model will be that you've protected yourself by getting a vaccine, and there will be some self-responsibility, and where people, if you're still concerned, then you might choose to wear a mask, right? An N95 mask, something that can protect you, but not everyone will be doing that, and not everyone will have to do that. I don't know, and I can't tell you exactly what that time is going to be, but what I can tell you is that it's coming, and it's coming quicker than I think that most people anticipated. And so we will continue to take the best medical advice possible, and as we learn more about these variants and how they're spreading, and then we'll continue to watch the numbers. We have metrics in place already. We put them in place early on. There have been some changes to them. I'm sure there will be more changes to them, but that govern how we do things, and the amount of people that can come together. But look, get this vaccine, because we will live happily ever after. We will be able to get back to normal. We will have celebrations and concerts, and we will get to hug our grandparents and all of those things again if you get the vaccine. So just get the vaccine.
Governor, if I could follow up on that, isn't there still a question about whether the vaccine protects a person from transmitting the virus?
Yeah, there is still a question about that, Lisa. But all of the research that we've seen so far, and there's been more just this week, including lots of data coming out of Israel that shows that it appears that it is successful in not transmitting the virus, so not becoming a carrier and not spreading it to other people. And by the time we get through the next couple months, I feel very confident that we will have a definitive answer on that. But it does look really, really good. And again, most importantly, though, it protects you, right? And so that's why we need everyone to get this vaccine, and we'll continue to encourage people to get that vaccine. But again, at some point, right? At some point, everyone has a choice to make, and everyone has to be responsible for that choice. And that's what we believe in. That's different than a pandemic where we're all at risk, versus now we've all had an opportunity and a chance to be protected and to get that vaccine. So we're very bullish and very optimistic.
Good morning, Governor. Jed Bowl from KSL TV. The state was able to vaccinate 100,000 people over the past week. What kind of capacity do we need to expand to in order to roll out those vaccines when you open it up to everybody in April and May? So what kind of expanded capacity do we need, and how do the volunteers help with that effort?
Jed, thank you. We did 100,000 vaccinations this week. Those are first and second doses combined, right? So that's where you have to start thinking very strategically. So how many first doses are we giving? When are we giving those? And then 3 to 4 weeks later, we have to be able to give double those doses, because the second doses are rolling around. And then you add Johnson & Johnson on top of it potentially, where it's only a 1-dose vaccine, right? So that changes the computation. We're working on a spreadsheet that is one of the most complicated spreadsheets I've ever seen, that actually lays all of this out day by day, week by week, assuming best case scenario as those vaccines come. But you ask a question, I'm going to try to answer it. So we did 100,000 vaccines in the past week. We're going to have to get up to where we're doing 300,000 doses in a week to 400,000 doses in a week, we think, probably into April and May. Those are the numbers. So we're looking looking at really triple what we're doing now. And so that's where we haven't maxed out our local health departments, but we're getting closer. Local health departments can do 100,000 a week. They've proven that already. We know they can do a little bit more than that. And so now what we're doing with every one of these partners is finding out, okay, what is your capacity? How many can you do every day? And then we're just layering that on top. And it really is a math problem at that point. It's a logistics problem. I've said it's more of like an Amazon problem instead of a healthcare problem. It's how do we get the package on your doorstep in one day instead of 2 weeks? That's the type of thinking that's happening out there, and we've got some really great people doing it. But again, as the Lieutenant Governor mentioned, that means getting every piece of that. There's a constraint, right? We have to have enough, and we've run into this. First of all, you have to be able to schedule. That's the first constraint. The second constraint is now: do we have enough parking? Do we have enough? Do we have enough places? Are we overcrowding someplace? Do we have data entry folks to get those in? And then do we have enough nurses and doctors and others who can actually put the needle in the arm? Every one of those is a constraint that we have to think through, and every one of those is going to need volunteers to make that change. Last question for me, and then you can then Angela can come and fix everything I just said. So, Dr. Dunn, I'm sorry, I should be more respectful.
Hello, good morning. This is Sebastian from Univision. My question is going to be in Spanish for Governor Cox. It is going to be related to volunteering and vaccines for undocumented immigrants, so that you may answer later, Governor, in English as well, if you like. Gobernador, ¿cuál será la política del estado de Utah en cuanto a la aplicación de vacunas para inmigrantes indocumentados? ¿Podrán también ser elegibles para recibir la vacuna algún momento en el futuro o ahora mismo, si es que califican dentro de los segmentos de población? Considerando que se calcula que en nuestro estado de Utah viven al menos 100,000 personas sin documentos y podrán también ser partícipes voluntarios para el proceso de vacunación, gobernador, si es que ellos desearían hacerlo.
Bueno, thank you, Sebastian. Of course, you would save a question in Spanish for the very end, and now I've got to get my mind thinking differently. So let me answer. I'll answer in English, and then I'll try to answer in Spanish. So the question was, we know we have people who are living here who are undocumented, immigrants living in the state of Utah, and the question is, are they eligible to get the vaccine? And are they eligible to volunteer? I think also was part of the question. And look, this is a global pandemic. The virus doesn't care where you're from. The virus doesn't check to see if your papers are good or valid or not. The vaccine is only looking for hosts. It doesn't care what language you speak. It doesn't care what you do for a living. It doesn't care about any of those things. It just cares if you're a living, breathing human being. And our response to the virus should be the exact same. We need to treat the virus the way the virus is treating us. And that means that the answer is yes, that if you live here in the state of Utah, you're eligible to get that vaccine if you meet the other eligibility requirements, right? As long as we have a constraint on the amount of vaccine that's available, then we're going to use that vaccine. So if you're over the age of 70 or older, you're a healthcare first responder, teacher right now, those are the qualifications, and that's what we care about, and that's what matters right now. None of the rest of this matters, and so that hopefully that's an answer. Ahora voy a tratar de dar una respuesta en español. Ese virus, el coronavirus, no importa de dónde viene, si tenga papeles o no tenga papeles, si está aquí legal o ilegal. Esa enfermedad solo quiere que esté un humano que sea vivo y si tenga la oportunidad de hacer una persona enfermar una persona. Así que Nosotros también, a nosotros no nos importa de dónde venga. Si está de una edad más que 70 años, ya ustedes pueden recibir la vacuna. Y es importante que cada persona que vive aquí en nuestro estado tenga la oportunidad de recibir esta vacuna y también tenga la oportunidad de ayudar a los demás que ellos pueden recibirlo también. Además, estamos trabajando muy fuerte de hacer seguro que tenemos la vacuna en lugares diferentes en el estado, donde viven las personas que hablan español, que sean de diferentes lugares para que ellos también puedan recibirlo. I hope that's helpful. I hope somebody can translate that in a much better way than I just did, but hopefully we've got it. Thanks to everyone again for your patience through this. Inherent in some of those questions that I didn't answer is that as we bring on different partners, and as the federal government has brought on different partners, they do have different scheduling softwares and websites and those types of things. We would love to be able to coordinate all of this into one beautiful package where everyone can go and sign up to get that vaccine. But as I've talked to governors across the country, we've all realized that that's not going to happen. Walmart has their system and Smith's has their system, and I know that's difficult and a little bit chaotic, but we're learning to embrace the chaos, and we really appreciate your patience. So people have asked, as those new doses come in, you're going to have to check with Smith's and Walmart on their websites. We will try to unify wherever we can and make it more simple, but we're going to get through this together. So thank you. It's been a great week. Again, Dr. Dunn will be here to answer some other questions, and we can't wait to see you back next week. Take care.
All right. Any additional questions? Oh, go ahead.
Hi, Dr. Dunn. It's Sean Maines at the Tribune. You mentioned the variants. What's our standing right now with that? Last time we talked a few weeks ago, we had one case in Utah County, one case in Salt Lake, and one case in Summit County. How much of the variants have we seen in Utah up to this point?
Yeah, so we still remain at 3 for the B117, which is the variant that was first identified in the UK. Again, we're sequencing as many samples as we possibly can, given our restraint and resources right now at our lab, and hopefully we'll ramp that up as we get more of the materials necessary to sequence them. But so far, 3 with the UK variant.
How about any others that have popped up yet?
No, thankfully.
Okay. Thank you.
Hi, Dr. Dunn. I'm not sure if this is a question that's more appropriate for, say, somebody handling the rollout, but we saw a Facebook post from the Ute tribe. It said that they're not getting as many vaccines as they believe that they should be getting, and they linked it to the 2020 census count, and they say that they participated in it, and so they're wondering why they're not getting as many as they believe they should be. How is the state handling vaccine getting to the native tribes and native nations in Utah?
Sure. So I don't have tons of details on this, but what I can tell you is that our tribal partners have the ability to rely on the federal government and get direct vaccine from them or the state. And the vast majority of tribes in Utah have elected to get the vaccines directly from the federal government. I hadn't heard the specific issue you mentioned, but I'll certainly look at it. But for the most part, this is a federal tribe relationship. Oh, thanks. Yeah, and then specifically, Utah Navajo Health has chosen to work with us more directly, and we've been giving them, that's right, giving them doses directly as well from our Utah supply.
Great. Dr. Dunn, Chris Reed, St. George News. And the governor referred to feeling a shift and also referred to the fact that we've had decreased hospitalization, we've had decreased deaths. Is this shift strictly because of the rollout of the vaccine? Is there another cause? And on a secondary question, last week you talked about that Southwest Utah might be a problem spot or lagging behind. Has that changed in any way?
Sure. So our decrease in case counts and thus hospitalizations and deaths is largely due to the consistent policies we've had in place for the past several months and the adherence to those guidelines and policies by Utahns. We are seeing some evidence that the vaccine is starting to decrease spread, especially among healthcare workers. And over the next couple months, we'll start seeing the impact from vaccinating 70 plus in long-term care facilities. But right now, it really is a result of really good policy and adherence by the general public to these guidelines and policies. I'm happy to say that all of our local health departments are seeing a decline right now. So it is a statewide decline, and we hope that continues.
Hi, Dr. Dunn. This is Jacob Klopfenstein with KSL.com. From what I've heard from people who have gotten vaccinated already, in a lot of cases, there's not a whole lot of guidance on how they can or should, change their behaviors after they get vaccinated. They go to the clinic, they wait 15 minutes to make sure there's not an adverse reaction, and then they're sent on their way. I'm wondering if you can clarify if there's to what extent are people who are vaccinated now able to change their behavior with regards to, social settings and things of that nature? Are they able to change their behavior, or should they still, keep wearing masks as much as the rest of us right now?
Sure. So I'll first note that on our coronavirus.utah.gov website, we do have FAQs that address these, and I'm happy to address them now as well. So the one major thing that changes 2 weeks after you finish your vaccination series is that if you're exposed to COVID, you do not need to quarantine. So we won't be asking you to stay at home for 10 days if you've already been vaccinated, again, 2 weeks after you finish the series. We do recommend that every individual continue vigilance with mask wearing, physical distancing, and avoiding large gatherings. And a lot of that is because, again, there's still lack of evidence of, one, whether the vaccine can prevent transmission, especially with these new variants coming online. So we want to make sure that we use every public health tool available to us to continue the decrease in cases. Right now, we don't have enough people vaccinated in our state to use vaccine as the only prevention measure for spread. So it's really important we continue to adhere to physical distancing and mask wearing. And so I do think that, as time goes on and we get closer to that 70 and 80% of Utahns vaccinated, we'll start to see what our policies should look like then. But for the next several months, continue mask wearing and physical distancing, regardless if you've had your vaccine or not. Okay, thank you very much.
All right. Thank you very much to all of our media partners. We appreciate you and your diligence to accuracy each and every week. Thank you for attending. Thank you to our interpreters in Spanish and American Sign Language. And we will talk to you in 1 week. Thank you.